Your doctor is going to suggest lifestyle changes. If after a few months we notice that despite the changes in the lifestyle, our blood pressure remains high, we then start to talk about initiating medications. So if your blood pressure is very, very high, you likely are going to have the doctor suggest you start blood pressure medication right away. We have a series of medications out there that the doctor will likely prescribe to treat your blood pressure, and these medications include most commonly a diuretic, which is a water pill. The way it works is ultimately it releases fluid from the body and lowers the blood pressure that way. Another agent is an angiotensin II receptor or an ACE inhibitor, which both those agents work in the kidneys, and by doing that it lowers your blood pressure. Other medications that your doctor may prescribe include a calcium channel blocker or a beta blocker or alpha blockers. And lastly, a medication which we also tend to use, depending on the medical condition, are vasodilators.
So when we're making the decision on what to use to treat a patient's blood pressure, we very much rely on their risk factors. For example, a patient that has heart failure with a weakened heart is going to benefit from an ACE inhibitor or an angiotensin receptor blocker. Often those patients also do well with diuretics because we can bring down the fluid retention that they have with their heart failure state. Patients that have angina or chronic chest discomfort because of coronary artery disease sometimes will benefit from a calcium channel blocker because in addition to lowering blood pressure, it also can dilate the blood vessels or make the blood vessels bigger so that you get more blood supply to that muscle. So in general, we try to start with one medication and maximize that medication, but we often find that that's not enough. And if we bring a patient back and they've been on one medication and they've been taking it the way it's prescribed and they still have high blood pressure, that's the time when we generally think to add either a second or even a third medication.
And when we're starting you on these new medications, it's important to follow up within 4 weeks with the doctor, not just to get your blood pressure rechecked and also to see how your symptoms are, but also to get blood work to make sure that you're tolerating the medications appropriately.
It's important for patients to know that any medication can potentially give you side effects. If there's something specifically you're concerned about or you're not feeling well with your medication, go talk to your doctor because certainly we have many choices when it comes to blood pressure medicines, and if something's not working, your doctor can switch you to something else.